Question 1. Which task is appropriate for the RN to assign to the UAP? A. Administering oral medications. B. Assessing a patient's respiratory status. C. Transporting a stable patient to X-ray. D. Teaching a patient about wound care. Answer. C. Transporting a stable patient to X-ray. Question 2. The nurse is caring for 4 clients. Who should be assessed first? A. A client post-op day 2 requesting pain meds. B. A client with new onset slurred speech. C. A diabetic client with blood sugar of 190 milligrams per deciliter. D. A client with nausea after chemotherapy. Answer. B. A client with new onset slurred speech. Question 3. Which activity is within the LPN scope of practice? A. Initiating IV therapy for a new admission. B. Conducting a full physical assessment. C. Reinforcing patient teaching on diet. D. Creating the discharge plan. Answer. C. Reinforcing patient teaching on diet. Question 4. Which action by the UAP would require immediate correction by the RN? A. Assisting a patient to ambulate with a walker. B. Offering a patient ice chips after surgery without checking NPO status. C. Helping a patient use a urinal. D. Changing bed linens in an isolation room. Answer. B. Offering a patient ice chips after surgery without checking NPO status. Question 5. The RN assigns vital signs of a stable post-op patient to the UAP. What should the nurse do next? A. Recheck all vitals after the UAP finishes. B. Document the UAP's findings. C. Ensure the UAP knows when to report abnormalities. D. Delegate medication administration as well. Answer. C. Ensure the UAP knows when to report abnormalities. Question 6. Which patient requires immediate assessment by the nurse? A. A patient reporting constipation. B. A patient complaining of a sore throat. C. A patient with oxygen saturation of 85%. D. A patient with a mild headache. Answer. C. A patient with oxygen saturation of 85%. Question 7. Which is the most appropriate delegation by the RN to the UAP? A. Performing a Foley catheter insertion. B. Assisting a patient with range of motion exercises. C. Providing discharge instructions. D. Assessing a post-surgical dressing. Answer. B. Assisting a patient with range of motion exercises. Question 8. A nurse delegates repositioning a patient every 2 hours. What must the nurse do next? A. Trust that it is completed. B. Document the delegation. C. Supervise and follow up on task completion. D. Ask the family to monitor the task. Answer. C. Supervise and follow up on task completion. Question 9. Which action is a priority for the nurse receiving a new admission from ER? A. Assigning the patient to a room. B. Delegating vital signs to the UAP. C. Completing the admission assessment. D. Asking the family to provide history. Answer. C. Completing the admission assessment. Question 10. Which patient is the highest priority? A. A patient with a rash and itching. B. A patient with a fever of 101.2 degrees Fahrenheit. C. A patient with sudden onset of confusion. D. A patient needing a wound dressing change. Answer. C. A patient with sudden onset of confusion. Question 11. Which task can the nurse delegate to the UAP during a busy shift? A. Monitoring for post-op bleeding. B. Collecting a clean catch urine sample. C. Assessing response to medication. D. Teaching how to use a walker. Answer. B. Collecting a clean catch urine sample. Question 12. Which situation requires the RN to intervene immediately? A. UAP assisting with meals. B. UAP walking a patient post-op with dizziness. C. LPN administering oral meds. D. UAP repositioning a patient. Answer: B. UAP walking a patient post-op with dizziness. Question 13. Which task is most appropriate for the LPN? A. Initial assessment of a patient with chest pain. B. Educating a patient about insulin pump use. C. Administering scheduled tube feedings. D. Titrating for heparin drip. Answer: C. Administering scheduled tube feedings. Question 14. Which action is best for the RN to take when the UAP refuses a delegated task? A. Assign it to another UAP. B. Document the refusal and inform the manager. C. Ignore the issue. D. Perform the task without addressing the concern. Answer: B. Document the refusal and inform the manager. Question 15. Which task must the RN complete and not delegate? A. Emptying a surgical drain. B. Teaching insulin administration. C. Feeding a patient with one-sided weakness. D. Helping a patient walk post-op. Answer: B. Teaching insulin administration. Question 16. A nurse is triaging patients. Who is the highest priority? A. A patient with stable vital signs and leg pain. B. A patient with chest pain and shortness of breath. C. A patient with a small laceration. D. A patient with mild dehydration. Answer: B. A patient with chest pain and shortness of breath. Question 17. Which is the most appropriate action by the RN when a UAP reports a high blood pressure reading? A. Tell the UAP to recheck it later. B. Ignore and continue rounds. C. Assess the patient personally. D. Delegate it to the LPN. Answer: C. Assess the patient personally. Question 18. Which duty is within the LPN scope in an acute care setting? A. Teaching pre-op instructions. B. Completing a new admission assessment. C. Reinforcing post-op wound care instructions. D. Initiating a blood transfusion. Answer: C. Reinforcing post-op wound care instructions. Question 19. Who is the priority for the nurse to assess? A. A patient with a blood sugar of 200 milligrams per deciliter. B. A patient with a Foley catheter complaining of lower abdominal pain. C. A patient due for discharge in 30 minutes. D. A post-op patient due for vital signs. Answer: B. A patient with a Foley catheter complaining of lower abdominal pain. Question 20. A nurse hears a UAP tell a patient, "Just get up and walk. It's not that hard." What is the best initial response? A. Document the UAP's behavior. B. Report the UAP to the supervisor. C. Immediately intervene and speak with the UAP privately. D. Ignore it unless it happens again. Answer: C. Immediately intervene and speak with the UAP privately. Question 21. A nurse delegates ambulation of a post-op client to a UAP. What instruction is most important to provide? A. Encourage the client to ambulate as much as possible. B. Ensure the client wears non-slip footwear. C. Let the client ambulate without a gait belt. D. Ask the client to walk to the restroom independently. Answer: B. Ensure the client wears non-slip footwear. Question 22. A nurse is assigning patients to a float LPN. Which patient is most appropriate? A. A newly admitted patient with diabetic ketoacidosis. B. A patient requiring central line dressing change. C. A stable patient needing routine wound care. D. A patient with escalating confusion. Answer: C. A stable patient needing routine wound care. Question 23. The nurse assigns a UAP to assist with feeding. Which client is most appropriate? A. A client with recent stroke and dysphagia. B. A client with facial droop and slurred speech. C. A client with mild arthritis in the hands. D. A client on thickened liquids and aspiration precautions. Answer: C. A client with mild arthritis in the hands. Question 24. A nurse observes a UAP transferring a weak client alone. What is the nurse's best action? A. Praise the UAP for efficiency. B. Immediately assist and educate the UAP privately. C. Wait to see if help is needed. D. Document the transfer technique. Answer: B. Immediately assist and educate the UAP privately. Question 25. Which task is appropriate for the RN to delegate to the LPN? A. Initiating a care plan. B. Performing an admission assessment. C. Reinforcing teaching about a low-sodium diet. D. Evaluating a patient's readiness for discharge. Answer: C. Reinforcing teaching about a low-sodium diet. Question 26. Which action should the RN take after a UAP reports a low blood pressure reading? A. Ask the UAP to recheck in 15 minutes. B. Assess the patient and validate the findings. C. Document the UAP's reading as is. D. Instruct the UAP to report to the physician. Answer: B. Assess the patient and validate the findings. Question 27. A nurse is assigning care for a client with neutropenia. Which staff member is most appropriate? A. A nurse floated from surgery who has multiple clients. B. A UAP assigned to 4 isolation clients. C. An experienced LPN trained in chemotherapy precautions. D. A new graduate RN with a full assignment. Answer: C. An experienced LPN trained in chemotherapy precautions. Question 28. A nurse is planning care for 4 clients. Who should be seen first? A. A client with COPD requesting repositioning. B. A client with diarrhea for the last 6 hours. C. A post-op client reporting calf pain. D. A client with a surgical dressing due for change. Answer: C. A post-op client reporting calf pain. Question 29. The nurse is assigning care to a UAP. Which statement is best? A. Let me know if you need help. B. Please help with all patient care. C. Take vital signs on Mr. Lee and report any abnormal results. D. You can help anyone who asks for assistance. Answer: C. Take vital signs on Mr. Lee and report any abnormal results. Question 30. A nurse delegates care to an experienced LPN. Which task is not appropriate? A. Administering intramuscular vaccines. B. Monitoring foresight for infiltration. C. Assessing pain level before opioid administration. D. Reinforcing teaching for wound care. Answer: C. Assessing pain level before opioid administration. Question 31. Which action by a UAP assisting a client with a stroke requires intervention? A. Elevating the head of the bed. B. Giving water with a straw. C. Assisting with ambulation to the restroom. D. Turning the client every 2 hours. Answer: B. Giving water with a straw. Question 32. A nurse assigns bed bath care to a UAP. What must the RN ensure first? A. The UAP has adequate time. B. The client consents to the task. C. The UAP understands how to assess skin. D. The client is stable for this task. Answer: D. The client is stable for this task. Question 33. A nurse delegates a task, but the UAP does not complete it. What should the nurse do first? A. Reassign the task. B. Complete it personally. C. Ask the UAP why the task wasn't done. D. Report the UAP to the manager. Answer: C. ask the UAP why the task wasn't done. Question 34. Which of the following would be a violation of delegation principles? A. LPN reinforcing blood pressure management teaching. B. UAP measuring urinary output. C. LPN initiating patient education on anticoagulants. D. UAP assisting with feeding. Answer: C. LPN initiating patient education on anticoagulants. Question 35. Which patient should the nurse assess first after receiving morning report? A. A patient with a mild headache. B. A patient with fluid overload and crackles. C. A patient with well-controlled blood glucose. D. A patient scheduled for discharge. Answer: B. A patient with fluid overload and crackles. Question 36. What is the RN's responsibility when assigning a UAP to measure vital signs? A. Document the results without review. B. Review and interpret findings. C. Ask the UAP to call the physician. D. Trust that the findings are accurate. Answer: B. Review and interpret findings. Question 37. A nurse is caring for 4 clients. Who is the priority? A. A client reporting nausea. B. A client with a pulse of 110 BPM. C. A client who is confused and trying to get out of bed. D. A client requesting assistance with bathing. Answer: C. A client who is confused and trying to get out of bed. Question 38. Which of the following tasks can be delegated to the UAP? A. Assisting with ambulation post-anesthesia. B. Feeding a patient who is alert and oriented. C. Administering oxygen to a COPD patient. D. Interpreting telemetry results. Answer: B. Feeding a patient who is alert and oriented. Question 39. What task must only be completed by the RN? A. Administering an oral medication. B. Conducting the initial patient assessment. C. Monitoring intake and output. D. Feeding a stroke patient with assistance. Answer: B. Conducting the initial patient assessment. Question 40. A UAP tells the RN, "I don't think I can handle this patient's care." What is the nurse's best initial response? A. You're assigned, please do your best. B. Let's talk about what part feels overwhelming. C. Ask another aide to switch with you. D. Just report if something happens. Answer: B. Let's talk about what part feels overwhelming. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.